to engage in services like this, even if they were willing to. Hope that answers the question.
Okay, thank you so much, Edward. I guess you basically covered the aspects of the questions, the question. So we'll be proceeding to the next question. Okay. Question number 3, what are the ways in which Allianz has helped address the protection gap in the country? From Justin Adrales, Chinese Commercial, I think, for Allianz.
Okay, thank you, Justin, for the question. Yeah, I think we since we came in 2016, we are constantly trying to address, of course, the protection gap more and more and more. So the first thing I would say, it is important to get reach. So there are 2 ways of reach. One reach is our branch network, which we are building ourselves for agency, as I said earlier. So that's something to be expanded. Currently we have 15 agency offices across the country, but of course we envisage to have much more to really cover the country much better, and then hopefully also in more provincial areas in future. Then in addition, of course, we have very strong partners. We have HSBC more strong in the metropolitan area, whereas PNB is a very strong partner with a branch network in the provincial areas. So they have more than 700 branches. So this gives us already a tremendous reach. Now the question is, how can we address the protection gap? Having this reach is really with the propositions we design. And the protection we can provide is twofold. One is financial services. Of course, we really want to protect the wealth of Filipinos and help them achieving wealth on the other side as well. And then, of course, we want to protect their health. So both comes along very closely, because usually if you're not health protected, it becomes also a financial burden. So basically all our product propositions gear towards the same direction. One is accumulating wealth and having funds available, which you can use, for example, also in emergency. And the other thing is to have really key protection products, which are more affordable because they don't have necessarily the savings component, but they really address a particular need, such as health insurance. And I would believe, for example, Allianz Well is a very good proposition, which is not yet fully understood by most of the population. Because you have your full healthcare, everybody knows the universal healthcare will cover, but it will not cover everything. The next layer is HMO. People, especially young people, they're happy to have HMO because they haven't experienced any hospital expenses above the limits which this HMO will provide. So there is a natural need to extend coverage and have coverage beyond that. So I think with Allianz Well we can address that. On the other, more affordable side, I think Easy Health is the key proposition which helps customers to get access and protect it. And that is Easy Health with a premium as low as 800 pesos per month, for example, which gives you a full coverage of critical illnesses, and it gives you hospitalization benefits. And then if you didn't have any claim in 5 years' time, it still gives you back some portion of the premium. So I think with that, we have already solutions to address the protection gap. We surely don't have enough, because the complexity and the segmentation of our customers is way bigger. So we really need to move also more into the micro-insurance sector to allow and to include more of the rural communities as well. And then, of course, digital transformation is a key element which helps us nowadays even more to get further reach. Now, during COVID, a lot of people immediately adopted to internet. Now, whereas my neighbors, for example, went to the grocery store in the past, now they're all ordering online. Nobody goes out anymore to the grocery store. I see cars coming by every other 5 minutes and delivering vegetables. So the attitude has changed, and the need of our consumers has changed as well. So with that, we of course need to think also on a digital from a digital point of view, how can we give access for the people also online? And that will also support them, as I mentioned earlier, for example, with a virtual sales process. So instead of going somewhere, you can just connect with us, and virtually we can have a conversation. We can do financial literacy and education, and we can help you finding the right solution for it. So I think with these things, we clearly can really address those protection gaps in the country, but of course it will take time as well. I hope I answered the question. Otherwise, please feel free to send follow-up questions.
Thank you so much, Alex. So we're off to the fourth question, Brian, please. I'll just go through the questions because it's already 11:47. So, okay, fourth question will be, how do you plan to choose the beneficiaries of Allianz Kaagapay? This is from LC Holinan, Negros Daily Bulletin. I think this is for Edward.
Yeah, just checking, coming off mute as well. Yeah, thanks, and really good question. Thanks, Elsie. Yes, yeah, it has been a really difficult question for us because we've started with a number of plans already that we've actually already started distributing, but yeah, given the protection gap, it's clearly never going to be enough. The way that we've done it is probably, it's actually been with the people that have engaged most in the healthcare. So we've obviously been working in sites in Capiz, Iloilo, as well as Luzon for a number of years, and a number of people have really been working hard to improve their health, working hard to improve their well-being through our existing services, and often that's done at their own cost, you know, so they're buying medicines out of pocket to improve their health, or they're working with us, and often they have to pay. So yeah, for the first step, we've actually given it to people that have really engaged in our maternal child health or other health programs, just because they've shown such investment personally into, you know, what we're trying to do and into their own health. So that's how we made the decision. We did all, but that said, we are also looking to offer a range of very affordable insurance plans that people can buy that are hopefully below market rate. And as has been said today, we'll continue to get more plans distributed as people buy the Allianz World product. And therefore, yes, the main focus is really just trying to reward people that have really been sort of engaged with us and really look to drive their own health and well-being to a more positive state. I hope that answered the question as well. But it was certainly a very, very hard question given the issues that are faced by so many Filipinos, especially in the rural areas.
Okay, thank you, Edward. I think Miss Elsie is looking forward to the time that Allianz Kaagapay would be going to Negros. I think she's based in Bacolod. Yeah, okay, so next question please, Brian. With the rising number of COVID-19 positive cases in the Philippines, how do you plan to promote insurance inclusivity and help Filipinos cope with this problem? This is by from Vince Samson, Asian Journal. I think this is directed to Alex.
Okay, thank you, Vince, for the question. And yeah, I do believe it's a very concerning question as well. I mean, currently looking at the cases, they are rising, and I think Ed has mentioned the numbers more accurately before. But I also would like to put it in perspective and also surely mention this is my personal opinion. But for me, it's not really a surprise that these cases are increasing significantly day by day, because also the efforts around testing are enhanced on a daily basis. So you see a large number of accredited laboratories added on a weekly basis. And of course, the more we test, the more we will get transparency on the real number of cases. And personally, I would assume the real number of cases with COVID-19 is much, much higher than what is reported as discovered cases, right? So why would it be so way less than in other countries here in the Philippines? So I don't feel that it helps to create paranoia around this. So we need to be aware, and I think it's well done in terms of reporting nowadays. There's a lot of data available, but also everybody has to work the data and understand the data, and not only look at an absolute number. So I think that's the first thing I would like to address. And then how do we handle like the COVID-19 period? Of course, we need to be there for our customers. So we also need to understand the consequences of COVID-19 for our customers. So I think the first things, and we are among many of the insurance companies who looked into this, but we specifically, we looked primarily, first of all, for any kind of COVID-related case or claim to our company, we decided we have to fast-track all our claims, right? So we need to make sure that access to the funds and the financials is as immediate as possible in order to allow to settle, for example, hospital bills, which are expensive. So we don't want this to become a financial burden for the families. The other thing is also the COVID-19 crisis has obviously an impact on the economy, has also an impact on financial expenses personally at home. So with that, we also consider to extend, of course, the payment periods and give our customers leeway in paying the next premium. Also understanding that, for example, digital payments are not easily accessible for everyone yet. A lot of people have bank accounts where they just try to go to the branch and the branch is closed because Essential Services only allows 50% of the branches to operate at the moment. So if you don't have any online banking available, then how could you pay your premium? So we need to understand our customers, we need to understand our customers' problems, and we have to react to that. So I think in this regard, we are very, very supportive of our customers. Then of course, looking into our health protection propositions, we include COVID-19 to make sure that customers are clear and feel comfortable about our protection and have a holistic protection and not mind COVID-19 any further and potential expenses which go way beyond the typical coverages of PhilHealth or of HMO. And I think the other thing I mentioned also is, again, digitalization. We need to do a better job in communication in terms of financial literacy. We need to provide the customers with more facts. So I think we are doing well there because during the COVID times, we have started much, much stronger to engage with our customers, much more frequently to communicate with them. And then at the end of the day, I think overall we need to give our customers the peace of mind. That's what we owe them. That's our key proposition, to give you peace of mind. If something happens to you, we are there for you. So that's really our key proposal, and we need to emphasize much more on that. And I think to quote also what has been reported by the insurance company, by the insurance commission, excuse me. So insurance companies have been very resilient here in the Philippines. So I think the number was shared also in one of my slides earlier. So since the COVID crisis, we have paid out more than 300 million pesos already in COVID-related claims. So that's very significant. And all of us are continuing to pay that. So I think that's something which underlines also, again, the financial resilience of the industry and what we can do for our customers.
Thank you, Alex. Yes, ever since you have emphasized simplifying communication and being customer-centric and engaging customers by communicating with them, that is empathy and giving them the peace of mind, especially in these times, crucial times. Okay, Brian, next question. Okay, so question number 6, why did you choose Iloilo as the first beneficiary of Allianz Kaagapay Nonoy Tatlino of Iloilo today? I think this is for Edward.
Yeah, just checking mute again. Yeah, I'm muted. Yeah, thanks for the question again. No. I guess, yeah, in the interest of time especially, it's a very simple answer. I moved to the Philippines 4 years ago to set up Reach 52, lived in Manila. We went to a number of sites, a number of municipalities, and Iloilo was one of the first and most engaged in our programs. We got great support at a municipal level, then up to provincial level. We've been there for the longest. We've got the strongest relationships there. We've had the best government support there for our programs, and it's just been a fantastic partnership that's almost as old as Reach 52. You know, it really was our first ever site. So when we have this innovation and something so critical as protection in this crisis, we really wanted to give back to Iloilo as being one of our first supporters and really help to model working and again continuing to sort of invest in our partnership. That said, yeah, over time we're really looking to go up into Capiz, Aklan as well, lots of conversations in Antique as well, so very strong in Panay Island. But we also do a lot of work in North Luzon as well. So as this program hopefully succeeds, we'll certainly be looking to expand it far beyond Iloilo and yeah, look forward to that.
All right, thank you so much, Edward and Alex. I think we have more questions coming in. However, as we said, in the interest of time, we'll be answering those questions via email and send them to you right away.